Welcome back. This month, the CDC released a new report on the number of suicides happening right now in the U.S. The report found that in 2021, this new report found that more than 48,000 Americans died by suicide. Now, for context, that is more than the number of people living in the city of Moline right now. And these are highest numbers since 2018. But there was even more data, and we want to take a look at this report today. There was a lot in there, and we have Angela Gallagher from NAMI of Greater Mississippi Valley joining us to break this kind of down for us, because this is research that you see every day. So thank you so much for joining us.
Well, great. Well, the research in particular that seemed most alarming was the fact that the CDC came out and talked about youth suicide rates.
Yeah.
And in particular, young women, the suicide rates had jumped significantly. I think, was it 60%?
It was a large number, yeah. And I thought that was very interesting. So why do you think something like that is happening?
So the CDC report pointed to sexual violence, continued harassment. Coming during the pandemic, of course, youth were sometimes cut off from activities where they would be allowed to blow off steam, to socialize. And I think coming through the pandemic, it's been surprising to me in a way, but if I don't have children, so maybe parents out there watching understand that socialization for the teenage brain, they rely heavily on interaction with their peers.
Absolutely.
And so to be cut off from that during the pandemic, I think the CDC is pointing to that as a reason for a spike in cases. The upshot of bullying, both in person, now that we're back in school, or also digitally. I know you had a family resource expert on another show here at Channel 8 a week or so ago, and they were talking about the fact that digitally we're never shutting down now.
Right.
We're not even comfortable and safe in our own homes sometimes. And so they were talking about isolation as well, feeling isolated in your own home, which to me is a terrible situation.
Absolutely terrible. And we were talking in this commercial break a little bit about a new Ipsos poll that kind of talked about what young people are going through when they are going through those gray areas, those dark spots, those dark moments in life. And you said something that surprised me, is that a lot of those children would feel comfortable talking to somebody, but they don't know how to start the conversation.
Right. So that poll was between the National Alliance on Mental Illness and Ipsos, the pollster, and it indicated that 95% of youth would be interested in talking about mental wellness or their mental health, but only 45% would even be willing to have that conversation. So we as adults, as caregivers, and even as educators in the school system need to be prepared to have those conversations. And an easy way to do that, maybe as a parent or caregiver, is even to talk about your own mental wellness and coping skills that you have, right? Because the teenage brain is still forming, and coping skills are something that need to be gained.
Well, and talking about those dark moments in time are definitely something that we all need to be talking about. I know that talking to somebody is something that saved my life. And so one of the things that was in the CDC report talked, though, about the disparity of the number of suicides and race, that found that the rates rose among Black Americans by nearly 20%. Meanwhile, in white Americans, it actually dropped, and it was the only group that actually saw a decrease. Why do you think there's a difference there?
So with both Blacks, Hispanics, and in the pandemic, the Asian populations were at greater risk. And part of that is socioeconomic factors. For some populations, there just is not availability to insurance, to health care, behavioral health, and also culturally appropriate sometimes, particularly in the Black community with adult Black men, they're often misdiagnosed. And it has to do with the various cultures' way of explaining what's going on.
Okay.
Right? So the providers don't always catch on to the clues.
Got it. Well, and before we let you go, we do want to talk about the resources that are out there to help. Talk a little bit about, really quickly, the resources that NAMI has to offer and ways that people should be reaching out and getting connected.
Sure. I'd like to remind everyone about 988, right? That's our new mental health emergency number. We're very fortunate in the Quad Cities to have mobile crisis teams, but if you dial 988, what they're finding statistically is only 2 to 10% of people actually need to be seen in person.
Oh.
We can get things resolved over the phone. We just need to talk to someone.
Just gotta talk.
NAMI has some programs, free public seminars where people can meet other family members who've been through similar situations. And also we have a program called Ending the Silence that we're beginning to take into the school systems, where a young person talks about their own experience growing up with a mental health condition, and we bring awareness to youth to make it okay to talk.
And it is definitely okay to talk. Angela, thank you so much for joining us today.
Appreciate it.
And we are going to take just a short break, but before we do want to let you know, as Angela was just mentioning, there is that 988 resource. So if you or someone you know is struggling with anything mental health related, give this a call or text them or visit 988lifeline.org.